You know how the eyes are called the windows of the soul? It is so true because subconsciously, when we first meet someone, we look at them eye to eye. And if somebody's eyes are looking tired, we worry and we wonder if they had a rough night or if they're having a rough moment in their life. Essentially, it can be the fact that the upper eyelids are heavy and also the lower lids are very puffy right through here. But usually when the lower lids are puffy right in the bottom, then right below that, what you notice is there's a dark line, and that's because that area has become very hollow. And so essentially you have the puffiness, which is the hill, but then right underneath it, you have a valley. So I used to make the incision here right below the lash line, but making that incision in the desert causes the eyelid to pull down and it causes dry eyes and the patients become very tear-eyed. And so you don't want to do that. What you need to do is to go in and take away the puffiness. And the way I do it in the desert, you have to pull the eyelid down and make a tiny little incision in the pink part of the eyelid with the laser and then take out the fat. And then what I do is I take some fat. Usually I like to take the fat from the lower abdomen because statistically it has the highest number of stem cells. And then I clean that, separate the oils, and I take the fat cells and I load them into 1 cc Botox syringes and I use a blunt micro cannula and I do fat grafting to the lower lid and I do tiny gentle movements like this. And as I'm moving the needle and the syringe back and forth, I inject a little tiny dot of fat in this area. So essentially, when you're done, you have populated fat in this area, kind of like the pattern of the leaves on a tree. Why do you do it that way? Because the body has to be able to grow blood vessels into each and every little dollop of fat that you've introduced into that area. So that fat then becomes incorporated into the body, becomes living and breathing tissue. The majority of patients are scared of fat grafting because the majority of doctors don't really know how to fat graft. And what they do is they inject and then they push the syringe and they deposit a big chunk of fat. And the body cannot grow blood vessels into that fat all the way. So the outer portion of the fat lives, but the center portion dies and then it gets really hard and it becomes granulated and it becomes like scar tissue. And so then you need to go back and surgically remove it.